Standard precaution. Standard precautions are a set of infection control measures that are universally applied to prevent the transmission of infectious diseases in healthcare settings. These precautions are based on the assumption that all patients could potentially be infected with a blood-borne pathogen or other infectious agent. Here are the key components of standard precautions. 1. Hand hygiene. Regular and thorough hand washing with soap and water or using alcohol-based hand sanitizers is essential to prevent the spread of infection. 2. Personal protective equipment, PPE. Healthcare workers should use appropriate PPE, such as gloves, masks, gowns, and eye protection, depending on the anticipated exposure to bodily fluids or infectious agents. PPE should be worn and removed correctly to prevent contamination. 3. Respiratory hygiene, cough etiquette. Patients and healthcare workers should follow respiratory hygiene practices, including covering the mouth and nose with a tissue or elbow when coughing or sneezing, and disposing of tissues properly. 4. Safe injection practices. Needles and other sharps should be handled safely to prevent accidental needle sticks injury. Single-use items should not be reused. Proper technique should be used for all injections to prevent the transmission of blood-borne infections. 5. Safe handling of contaminated equipment. Proper handling, cleaning, and disinfection or sterilization of equipment and instruments are necessary to prevent the spread of infections. 6. Environmental cleaning. Regular cleaning and disinfection of patient care areas, surfaces, and equipment should be conducted using appropriate disinfectants. 7. Waste management. Proper disposal of all types of waste, including medical waste, sharps, and contaminated materials, should be done according to established guidelines. Sharps, such as needles and scalpels, should be disposed of in puncture-resistant containers. Other types of waste should be segregated, appropriately labeled, and disposed of according to local regulations. 8. Occupational health and vaccination. Healthcare workers should be up to date with their immunizations, including vaccinations for diseases such as influenza and hepatitis B. They should also be aware of and follow any occupational health policies, such as reporting exposures and seeking appropriate medical care if necessary. It's important to note that these are general principles of standard precautions, and specific practices may vary depending on the healthcare setting and the type of infection being addressed. Always follow the guidelines and recommendations of your local health authorities and infection control experts for the most accurate and up-to-date information. Thanks for watching.